Hi guys, it's Miss Sarah from the West Bank Club, and I am interviewing Dr. Keke today. So Dr. Keke, could you tell me what your career is and briefly explain what you do?
I'm a hospital pharmacist, so I work at Tulane Medical Center. When patients are sick, they come into the hospital and they see a doctor, a pharmacist, and a nurse, and other personnel, but collectively we decide what medicines are best for the patient to help them get well and go home.
Well, that's really important stuff. So what were your favorite subjects growing up as a kid, both like elementary and up to high school?
Math and English.
Hmm, English was one I wasn't expecting.
Yeah.
So to be a pharmacist and to be specifically a hospital pharmacist, what kind of schooling did you have to go to complete to get to where you are now?
So there's 4 years of undergraduate education. So you get your bachelor's. Then there's 4 years of pharmacy school after you complete your bachelor's. And then there can be anywhere from an additional 1 to 2 years of residency after completing pharmacy school, just depending on what area you want to specialize in.
So do you have to go to a residency, or is that only if you're looking to do something specialized, like Dr. Mary, who we interviewed earlier, is a vet pharmacist, and she had to do that, and you had to do that for hospital? Or can you just start right out of school?
Yeah, it's optional. It's not required. It's getting to the place where more jobs are preferring that you have residency training, but right now it's optional.
Okay, good to know. So it sounds like you've got a lot of school under your belt. Does most of it apply to what you're doing now, or does stuff not apply to what you're doing?
A lot of what I learned in pharmacy school applies to what I'm doing now. So a lot of the math, a lot of the study evaluation that we did, different pharmacy subjects like kinetics, all of that applies to the job that I'm doing now. So pharmacy school really did help me prepare me for my job now.
Is there anything you wish you had learned in school that you didn't, and kind of seeing that it would be really important now?
Yes, I wish I had learned more life skills, managing finances, communication skills. I wish that school had more emphasis on like mental and physical health. So just more life skills I wish were taught in school.
Well, they are really important, especially finances, because they impact you every day.
They-
So when did you start working in your current career? Was it immediately after getting out of school, with your residency, or was there did you do other internships, things like that?
no, so right after school, I went to work and I've been working ever since, about 6 years now.
Okay. What would you say is, I mean, with all the schooling, and you kind of might know what to expect, but what would you say the most unexpected part of being a hospital pharmacist is?
Um, I guess we can't save every patient's life. So when we lose patients, I really never expected to see that part of it. And it's kind of difficult to deal with, especially with COVID. We've lost a lot of patients to COVID, but it's part of it.
Mhm. Would you say that's also the hardest part of it?
Yeah.
Kind of, yeah, that's definitely, I can understand how that would be the hardest. Well, so to flip that, what's the best part of being a hospital pharmacist?
Saving lives. So when patients get better, we see them go home, reunite with their families. We know we've done our job. And to the best of our abilities, it's really rewarding to see those patients get better and go home.
So you actually want to see your patients almost as little as possible, get them better and send them on
And,
out.
right.
So if somebody told you that they wanted to grow up to be Dr. Keke, what advice would you give them?
You got to have discipline. Be ready for school and more school. But more importantly, make sure it's what you want to do. So when I was in school, I really wanted to make money. I mean, I would Google highest paying jobs because I really wanted to make money. And that, looking back, that's not the best way to choose a career. So you have to choose something based on what you love to do. And then the money will come. If you're really good at what you do, you know, you show people your value, the money will come. But make sure it's what you love to do. And if you do love to do pharmacy, that's great. Just be prepared, have discipline, apply yourself, study as much as possible, you know.
Well, I know that because through Dr. Mary, who we spoke to, and knowing you through some of your schooling, definitely takes a lot of work. So it's something to be committed to.
Yes. Yeah.
And how far up? I mean, when you were looking at the list, did you pick pharmacists from the list you were Googling, or did you just figure out that you loved pharmacy and kind of the math with it as well?
Yeah, actually, so I got a job when I was in high school working at a pharmacy, and I loved it. I fell in love with it, and it happened to be on the list as well. So I was like, oh, this is what I'm gonna do this. And it's been working out good thus far. You know, it took a while. So like you said, you do have to be really committed to it. But just don't give up, and you know, stick to what you want to do. See it through to the end.
Well, I think that's some great advice, and definitely great advice to not just go by what you Google to pick your career. Which
serious thought into it.
I definitely know some of my kids have done that, so it's great advice to tell them to maybe go with a different reason. Well, I thank you so much for taking time out of your busy day, and hopefully you might see some of us around Tulane. We're there. Hopefully just for a visit, not as we need to be.
Just visiting.
All right. Well, I hope you have a great rest of your day, Dr. Keke.
Thank you. Thank you so much, Ms. Sarah.